everybody. Thank you for listening. Thank you for watching the Healthy Project podcast. I'm your host, Corey Dion Lewis. I got the homie today. I'm not even taking this serious. This is
I told you we'd start laughing right away as soon as you started.
yes. So, Dr. Chayla Morris, I'll let you break down your whole credentials because I know there's an alphabet behind your name, and I don't want to disrespect you. But not only are you a panelist for My City, My Health 2023, you were a panelist 2022 for the
Yes.
very first My City, My Health.
Yes.
And we're running it back. So tell the people who don't already know a little bit about yourself and what you do.
Sure. So, as you said, Dr. Chayla Morris, I'm a pharmacist by trade. My current title is Clinical Pharmacy Coordinator at Brownlands Medical Center. Most people don't quite know what that means, but I like to explain it as my main role is starting different pharmacy-led services throughout the hospital, focusing on outpatient clinics, ambulatory care, but we also do a ton of community outreach and patient education and advocacy.
Yeah, so a whole lot.
Yes.
A whole lot going on. And I had the opportunity, so as the health coach, I had the opportunity of working, before we even got to work in the clinic, we did, that project's a whole nother story. We ain't gonna do that today. But
Well, it's a good background, though.
yeah. But I think for a lot of people, it's like, well, how could a pharmacist and a health coach work together? You know what I mean? It's like, well, it works really well. And we
Absolutely.
have a patient that really, really loves that she can see both of us on the same day. So, but you won't be doing that anymore because you'll be coordinating the people who will be in the clinic.
But I think that speaks to healthcare in general. It's all about collaboration, right?
Yes.
So a pharmacist doesn't just deal with medication, even though we're experts in it. We still help with lifestyle things. Some patients may tell, one provider something and not another provider.
Yep.
So I think we work so well together because we can collaborate on what's best for our patient.
Yeah, and it works well. It was my first time collaborating with anybody outside of like just talking to the other health coach.
Oh, I didn't know that.
Yeah. Yeah,
I just showed up.
you just showed up like, what's up? Yeah, it was my first time, and it was I knew it was going to be cool because we had already connected.
Yeah.
But like it was just like more curiosity of like I wonder what it's going to be like working with a pharmacist too, and it was dope. It was dope. So, My City, My Health.
Yes.
Tell me, your first thoughts from the first one. Let's start with that. What going into it, what were your thoughts? What did you think about My City, My Health?
Well, and I had just started at Broadlands too in April.
Brand new.
And then I think maybe by like June or July, you're like, hey, I'm putting on this conference. You want to be in it? And I'm like, okay, I don't know what you want me to talk about, but sure. So I went into it and I didn't know what to expect. And honestly, my mind was blown.
That's dope.
Because I'm from Des Moines and I've grown up here, born and raised. We just have not had anything like this before, specifically around health equity. And then all of the different types of people that we have in the city. Where can we all come together to discuss topics like that? So I think this was the first conference of its kind where we could all come and just listen and just take in other people's experiences and what they're going through with their clients or patients and get that feedback off of each other. And it was such a vibe.
It was such a vibe. And people you wouldn't think that little piece would make a huge difference.
It does.
Man.
It's that inclusion piece. We didn't feel like...
I didn't think it was the inclusion piece.
It's inclusion because just because you're in one sector or one field, you didn't feel separated.
Right.
We were all together and learning from each other. Definition of inclusion.
Definition of inclusion. And the reason why, not only because you were the homie, and the reason why I wanted you specifically in the prevention panel was because of my experience with being the health coach and working with the pharmacist. And I don't think we were really working. I don't know if you were in the clinic seeing patients quite yet, but the idea of pharmacy and prevention was intriguing to me. And I don't think a lot of people make that connection.
I don't think so either, but I love that because I get to help explain it to people.
Yes,
so
explain that to us.
A lot of times, and well, it makes sense, right? Something's wrong with you, so you get a medication, and so it's treatment, but a lot of medications also prevent further disease, further complications, or further worsening of organs or other disease states. And so sometimes people have to take a medication to prevent, a future heart attack or stroke. Sometimes we're
Right.
taking something to protect our liver or kidneys. And then I always love to tell people my favorite part is if I can take you off medication too. Because while we're using this medication to solve or fix what's going on right now, we're also learning other skills like that lifestyle piece, nutrition,
Right.
or whatever else, since I mostly work in chronic disease states. And so once we're getting that information, then we can back off of those medications.
Yeah, and I think pharmacists get a bad rap.
Yeah.
You know,
I think it's slowly changing, for good or for worse. The pandemic pushed pharmacy kind of out to the forefront because we had
Yeah.
to do a lot of things we weren't used to, and you couldn't always go into, your physician's clinics or doctor's appointments or anything like that. So a lot of the times the only person a patient was able to talk to was a pharmacist.
right. Something I heard during that time too from other pharmacists was, "Let me work at the very top of my license." But what is that for you? What does that look like?
Yeah.
If you were to work at the very top of your license, what does that look like for you?
So a lot of people don't know that a pharmacist does have a doctorate degree. We went to school for 4 years. We learn all about the medications, but also what it does to the body. We learn about lab values. We learn how to interpret things and adjust management of disease states or medications. And so while I don't want to diagnose or tell you what's going on, I can help you figure out what's best for you in your specific situation. And so I think a lot of the people, especially when they think of the community pharmacy setting or retail, they're like, all right, you got
Yeah.
my prescription. Why don't you just slap a label on it and
get-
put it in a
yeah.
bottle and hand it out to me? They don't know we're checking to see if there's drug interactions. We're trying to see if, you're supposed to have this medication or it's the correct dose for you. And then there's other types of pharmacies. So we have critical care pharmacists. We have oncology pharmacists. We have anything where you have a physician, there's a pharmacist.
Right.
And so in our primary care clinic and what we started, once the physician or provider decides, hey, you need like a little bit more in-depth education or management, go see our pharmacist. I see those patients
Yeah.
actually more frequently than they go see the physician. And we get to really hone in and focus on that. And from my experience, and I hope my patients' experience, they just come out so much more educated and empowered about what's going on with them.
Yeah, and then from a health coaching perspective, I don't got to worry about that because I already know you're going to deal with it. You know what I mean? Even if they're seeing you before they see me, or they're seeing me and then they're seeing you, I know that I don't have to work. They're going to ask questions. Well, I'm on this medication, this, that, and the third. Have you met Chayla yet?
Well,
Okay.
and I do the same thing for you. They're talking about all this stuff, and I'm like, okay, cool. So we talked a little bit about our eating habits, but have you talked to our health coach, Corey?
Yes.
He'd be great. And I love when we get to tag team.
Yes.
So I'll see someone. I'm like, okay, go wait in the lobby, and I'm knocking on your door. Hey, Corey, let me tell you about this patient real quick that's waiting for you.
It's so awesome, and I think for a lot of people, myself included, because the same way people don't think there's health coaches in clinics.
Right.
Like I feel like a lot of people think when they think pharmacist, they think Walgreens
Right.
or whatever.
And we need those pharmacists too.
Absolutely.
They're so important.
Absolutely, but they're not thinking, why would a pharmacist be like in the clinic?
Oh,
Like,
yeah.
you know what I mean?
Even the first couple of times I might see a patient, they're like, okay, so who do I need to talk to change my medication? I'm like, what? I can do that for you because I have an agreement with your provider and they've said,
Right.
hey, we can do this. Everything's charted. Everything's documented. But trust me, I know what's going on with this
Yeah.
medicine. When you come in next time and you're telling me all of these side effects or symptoms, the pharmacist is probably the one that's going to be able to identify what's going on.
Can we talk about side effects and stuff like that real
Yeah.
quick? Because I think that's kind of maybe where a little bit of the bad rap comes from is they're going to give me a pill that's supposed to help my left arm and my right leg goes numb.
I don't want that. My neighbor's grandma took it and
Yeah.
they're in the hospital now, and I'm not doing that.
So how do you combat that? Because that can be any medication.
Yeah,
That's not
absolutely.
your fault, but
We did not make the
you didn't
drugs.
make the drug. But how do you, knowing that there will be side effects,
Hmm.
do you prepare your patient for that? Like, what are some of the things that you're trying to like let them know? Like, hey, these could happen, may
Hmm.
not. Like, how does that conversation go?
Yeah. Again, it all goes back to education and empowerment.
Mm-hmm.
So when we're deciding on kind of next steps, because I do have that extra time, I kind of talk through why I'm choosing that for them. So,
Mm.
hey, we're talking about medication X. I think this would be good for you because it'll help. I'll just talk about diabetes for a second. It'll help lower your blood sugars. You might see some weight loss here. And I know those are goals of yours that
Right.
you want to work on. Now, here are some common side effects. Kind of run through the
Mm-hmm.
generic list. Some people will get that little pamphlet and it's got 20 different things on it. So
Yeah.
we have to
Mm-hmm.
kind of talk about that. But I let them know, hey, these are common side effects. Some of them, may go away over time. If it's ever overly bothersome, come let us know. And I think that's a big issue. Patients will just stop, but not tell anybody. So, say
Mm.
you didn't have that close follow up, your provider started you on something, you have an appointment in 3 months. Well, you took it and you didn't feel good for a couple days, so you stopped and nobody knew for 3 months.
Yeah,
And
that's
so
not
now we
cool.
have some like clinical inertia going on where it's not like your readings or values are getting better. No one knows you're not feeling good because of the medication, or it could even assess if that was the true reason. And now you're just kind of stagnant for 3 months.
Yeah, because that communication wasn't there or
Exactly.
open.
And so I always try to empower my patients. I'm like, you contact me if something's going on. If there's an issue with price, you let me know. If for some
Mm-hmm.
reason you couldn't get it for a couple of days or it's too expensive, like we have different avenues. And so I think
Mm-hmm.
just letting the patient know that you're not just giving them something, but you're part of a team with them.
Yes, and that's the other part when we're talking going back to like prevention
Yes.
is the information that you can give a patient.
Knowledge is power.
Knowledge is power, and one they don't know where to. I mean, I can only assume a lot of them don't know where to start. They
Oh,
don't know
for
what
sure.
questions to ask,
Yeah.
and allowing them to ask those questions in a safe place, and you being able to give them the resources.
Mm-hmm.
Cause I've experienced you even finding resources for people to get maybe um, lower copays or prescriptions or
Right.
whatever the case may be.
And I
That,
think a lot of the times people, just like you said, they don't know how or what to ask.
mm-hmm,
And so they don't know that there are resources available. And so that's a really difficult thing, I think, for some people to get over too. Because when you go into a physician's office or a doctor's office, you're like, okay, cool, they're going to tell me what to do. But you have to advocate for yourself too
yeah,
and let them know what your health goals are.
right. Do you feel like you do a lot more education in your session in your with your patients
Oh, yeah.
than you thought you would, or
I
yeah,
I would honestly probably say most of the times, the first session I may not even make a change unless it's something like crazy.
crazy?
It's more of like a, hey, we're getting to know you. What are your goals? What are things that you want to work on, or what are things you want to avoid? Right, going back to that
Mm-hmm.
prevention piece, I have a ton of patients that have a huge family history for cardiac or heart issues.
Mm-hmm.
They have had someone had to get something amputated or something's happened to them in the past and they don't want that experience again. So I need to know that so that way when we're
Right,
making changes or coming up with a plan, we can keep that in the forefront.
right. Have you ever experienced somebody that you were helping them with their medication, they were doing everything they could do or they can, and there was a time where you're like, hey, you don't need this medication, right?
Mhm.
Have you ever experienced someone being like scared of that?
Yeah.
Like, yo, like I don't want to get off this medication.
Yes. And I think that is such an interesting piece of our healthcare too, because
Mm,
medications don't fix everything. They do a ton, but
right.
especially in the primary care, family medicine, chronic disease world, um, it's helping, but then there's other things we have to work on. And sometimes people
Mm,
will use it as a crutch a little bit.
yeah.
And that's hard to tell someone, right? And it's like, no, you can do this. And
Yeah.
so, what I personally like to do with patients, I'm always like, okay, well, let's kind of reduce. We'll go down on the dose, see how it's going. If it go, your readings go back
Mm-hmm.
up or whatever, cool, we know. But if it goes down and it's fine, that's a good thing, right? Like, that's a good thing. That's what we want. You don't have to be afraid of change, whether that's starting
Mm-hmm.
something or stopping something. And again, I just think it goes back to letting them know what to expect, letting them know you're available to answer questions and that safe space, especially when it comes to their health care.
Yeah, I find that very very funny.
It's interesting. I
It
also
is.
have some patients, I tell them they don't need to necessarily see me anymore. And they're like, but I want to keep
I
coming
want to
to
keep
see you.
coming.
I'm like, so now I just tell them, like, no, you graduated.
You
You're,
graduated. Oh, that's so. You've
you
graduated.
graduated. If you
Congratulations.
need me, I'm here, but you don't need me right now. You got this.
Right.
Now go help somebody else.
I know that's so fun. I feel like people get so attached to the person that they feel like you did say you saved their life in a way, right? So it's like, well, if it wasn't for Shayla or whomever, my A1C wouldn't be normal. If I leave them now,
Yeah.
now I'm scared. Even though they're the ones going
They
out for the walks.
exactly.
They're the ones making sure they're taking their medications on
Exactly.
time.
And that's what I tell them, like, you did this. When you
Yeah.
leave this office, you have ample time and space to do whatever, but you chose to do the right thing. And
Right.
that's why you're improving and can stay that way. And you're preventing
Yes.
other things from happening
Absolutely.
to you.
What are some things that that you're working on right now as far as prevention going into the fall, school, all that? What are some things that you're doing currently to get prepared for prevention?
Yes. School season means kids need vaccines, kids need physical, so we're kind of prepping the hospital, getting ready for that. Especially, there's a lot of vaccine hesitancy and stuff, and I won't get too much into that. But
Lord
again, it's
Jesus.
just knowledge and letting people know what is safe. At the end of the day, you do what's right for you, but we also need to protect our community too. One thing we've been ramping up, and we've talked about this before, we started our Meds to Beds program.
Yep.
So when patients are getting discharged from the hospital on the inpatient side, we're able to bring up their medications to them and counsel them before they leave. And I just think that's been fantastic because, one, patients know exactly what's being given to them.
Right.
In a time where they're like, get me out of here. I'm ready to go. I don't want to stop anywhere and wait for like another hour for my
Yeah.
medicines. But we're also catching, any cost issues. Sometimes patients don't always pick
Yeah.
up their medicines. But if we know that, we can send like a heads up to the provider and say, hey, FYI,
Yeah.
Johnny didn't take this antibiotic right now, so maybe mention that or, discuss something at your follow-up visit. So there's just more communication. And so I think that's so great because so many things can go wrong when you leave the hospital. What if you don't exactly know what's changed and they told you stop something, but you have 2 bottles of it at home. Now you're taking
Yeah.
that with something new they gave you, and it's not.
Yeah, it's not a good look.
Yeah. So just that extra counseling and education piece, I think, has been so great. So we're really hoping to expand that soon.
Are there a lot of systems that have pharmacists a part of care teams? So like from my own experience, health coach, I don't know of a whole lot of places in Iowa that have a health coach and a pharmacist a part of a patient's care team. I personally don't know many.
Yeah.
I have a friend who's a health coach in New York. He's a part of a care team, and they do. Like they almost had the exact same setup
Yeah.
as far as having a pharmacist, health coach, they have a social worker, and their provider.
Oh, so they've got everybody.
Yeah, the
I
whole.
love working with social workers.
Yeah,
too.
they have the whole thing, right? Is it not as common to have a pharmacist a part of a care team, or is it more common and I just don't know?
a little bit of both,
Okay.
if that makes sense.
Explain, please.
So, like, in the hospital setting, there's definitely pharmacists. I think it also depends on, like, your size, too, right? Because you said your friend is from New York.
Yes.
So they've got a ton of people, a lot larger
Yep.
teams. Somewhere like Iowa, we do have them, just not in every single one, at least in primary care or family medicine, like, because I'm ambulatory care.
Right.
So that means you walk in and you walk out because I don't, I don't want to see you every single day in the hospital. But ideally, it's just another supportive piece.
Mm-hmm.
And one pharmacist can help, multiple physicians, obviously.
Right.
And so it's just one thing that takes something off of the provider's plate. It's something that offers more education and support to the patients. And then it's just a different viewpoint, too. One person can't do everything. Like, we need that collaborative team.
Absolutely. Absolutely. That's so cool. So, talking a little bit more about the conference this year, you're back on the prevention panel.
Yes.
Is there anything that you're excited about talking about, something that you want to talk about that maybe we talked about last year or we didn't or whatever? Is there anything that is that you're hoping comes out of this year's conference?
That's kind of a loaded question
Very
because
much
last
so.
year was so awesome.
Last year was so awesome. Man,
And I another reason why I think this conference is so cool is because it's so organic.
yeah.
And the conversations and the ideas that come out of it, you can try to prep, but you can't really prep, so it's cool.
Yeah.
But I think that one thing I really want to reinforce is we're all in this together, right? Even if you're not in healthcare, there's someone that's having health issues that listens to you. And there's someone that maybe just needs that extra push or extra, words of encouragement to do what they need to do.
Yeah.
And so that is so important. I don't think people realize the weight that their words have.
Yo, that's real. People
Because
don't know the weight that their
words
have.
Yeah. Because I've had patients come in and they were like, this person said this to me or I've been through this. And it just takes one person to push them in that right direction. And you can do that regardless of if you're in the healthcare space or not.
Yeah, that's so true. And that's what, Chayla, if I can have an honesty moment right now.
Okay.
Yo, I'm so nervous about this conference.
Why? Let's talk about this for a second. Let me interview you.
Yeah.
Let's talk about this for a second.
Because the first conference went triple platinum.
It did.
And everybody's waiting for the second album to drop.
Ooh.
Yeah.
And you don't want to hit that sophomore slump.
Sophomore slump. Now, mind you, I had Iowa City. I'm not trying to discount Iowa City.
This is the OG conference.
But this is the OG conference, right? There's a higher expectation for Des Moines. And don't get me wrong, we got some killers on we got some heavy hitters on this we got some coming back. We have a couple other ones that come back from last year. But man, I am like, please, do I got to hit somebody with a folding chair to make this thing go viral? I can't. This can't. I'll say this because it can. I mean, I don't have any control. Whoever's there is going to get very valuable information.
Oh yeah.
And it's going to be fire. But I just put so much pressure on myself for it to be the same level of energy as last year. I think the energy was there because, like you said, it was inclusive and it was never really done before like that. So as people were coming in and seeing it, you could see the energy level rise. Like, yo, this is not what I was expecting.
Well, let me put on my supportive team member collaborative hat for you. It's not just you, right? So especially because some of the panelists have been there before, people kind of know what to expect a little bit, right? Not everything. I think they're already going to come in with that energy.
Yep.
And that's what makes it amazing. If you come in there with your authentic self, you're open and you're just accepting what's going on and you're really willing to listen and hear and have those conversations, that's what makes it amazing.
Yes.
It's not just you. It's a lot you. Don't get me wrong.
No,
I
know exactly what you're saying,
but
though.
It's a team that creates that atmosphere.
Yeah,
that's going to keep making people want to come back.
You know what I'm excited about? Because last year you were hella nervous.
Oh, I was so nervous.
So nervous.
Because of the things. Listen, like I said, you asked me to do this like 3 months into my job. I'm still figuring out what do I even do at work so I don't get fined and I still get this paycheck coming in. I've never been on a panel before ever.
Yes.
You have me up next to people that have done like such amazing, fantastic things. Zakia with her business, Dr. Harvey, who's like such a pillar, and I'm sitting here like, okay, cool. I guess Corey wants me to be up here. I know we're friends and everything.
But I can't wait to see the confidence and the sweat. Yeah, I've been here this time. I know what's up.
I will take that challenge.
Yes, I am Dr. Chayla Morris.
Well, and I think that it's hard to see yourself in that position too. Like you can say amazing things about me and I'm like, boy, stop.
Right.
And I can do the same to you and you're like, girl, please. But that's kind of what it's all about
that's
too.
What
like
it's all
we
about.
hype each other up because we're awesome as a community.
Absolutely.
We do great things.
We do great things. Mm-hmm. Yes. And that's going to be it's going to be so much fun. I am not on a panel this year, so I'm like super excited just to like take it all in.
Are you not moderating anything?
No. Well, I wasn't supposed to moderate last year.
Oh, okay. You just stepped it up.
Shout out to Jody Long because she was supposed to be the moderator for the first panel.
Okay.
But she got sick.
Oh yeah. Okay.
So she couldn't do it. So I stepped in. So that's kind of what I'm doing. I'm like the sixth man.
Okay.
So like if anybody has an issue or can't do it, I'll step in. You know what I mean, and be a moderator. But honestly, I just want to soak it all in and just like watch like all these great people talking about great dope stuff.
Can I tell you one thing I remember from last year? So no, it's good. It's good.
Okay.
So on my panel when we had the Q&A, right?
Yes.
It kept going and going.
Shayla.
And I loved it, but then I looked down and I was like, are we still supposed to be talking? Like, is there a time limit? I swear I might have even looked over at you once. I was like, are we? Because it was like almost 30 minutes. It was something ridiculous. But I loved it.
It was so good that we had to add more time. Cause I wasn't expecting that.
Yeah.
How? Like,
but that's how you know your audience is engaged. They're there for the right reasons.
Yes.
This is not a conference where you're like, okay, well, my job's making me go, so let me go.
Yep.
Oh, yeah, I guess I got to do this thing. Like, everyone was there because they wanted to be.
Everybody had something to say, and you can tell it was from a sincere place. It wasn't like let me get the mic so I could talk about what I want.
That authenticity was unmatched.
It was very authentic. But imagine being the one running the conference and being like, yo, we were supposed to have a break 5 minutes ago.
You did say that.
we got to stop. So then like, Larry was like, hey, I'm just going to cut them off. Like, say one more. Like, we got to
cut off the mic. Just start playing the send-off music from the stage. But it was such a natural back and forth. And so I'm very excited to see that again. It's been a year. People have learned. People are doing different things. So it's just going to be a lot of newness.
A lot of newness, a lot of excitement. And it's going to be dope. And hopefully on time.
As much as it can be.
Shayla, thank you so much for doing. I knew this was gonna be dope. Like I wasn't even stressed about it. But for those who are listening, watching, that want to connect with you, where can they find you?
You can find me on LinkedIn, Chayla Morris, PharmD, BCACP. Open to any questions, comments, ideas.
Consulting.
Yes, consulting. Not only on pharmacy-related things, but health equity, DEI in the healthcare space, and inclusivity with collaboration on healthcare teams.
Yeah. Can we talk about your consulting?
Yeah, sure.
Yeah.
A little bit.
A little bit. Tell me, how's that? Tell me, I know you just said, DEI, pharmacy, everything. What can you do for, like, what do you do for an organization? Like, when you say, I can consult for you, what's the home run for them? What do they get?
You are getting a new aspect and view of ideas of how in this super weird landscape of healthcare we're in right now, because it's very awkward. And I think there's a lot of changes, not only for providers and people on the team, but for patients as well. How we can open those doors so that everyone feels safe and everyone feels like they are cared for and they're in a place where they need to be. Like I said, whether that's the providers, because there's been a lot of issues with staff being treated inappropriately, whether that's in an organization or outside of it from the patients, whether that's the patients coming in and feeling like they can be their authentic selves and deserve the best care that they need. That's what I can help you out with, see what kind of issues are going on and how we can effectively fix those.
That's real. And I'll make sure I link your LinkedIn profile for anybody that wants to connect with you and rock with you on getting their organization back on track.
I appreciate you, Corey. From day one, you're like, we're going to do this together. I'm like, okay, cool. But you've always meant it, and I appreciate that, genuinely.
Oh, of course. You're the homie. Everybody, again, Chayla, thank you for being here.
Thank you for having me.
Everybody, thank you for watching the Healthy Project podcast. I'll let you next time.